Most days, before you begin work at Greenville Memorial Hospital, you've already put in a full shift at home. As a party planner, tucker-inner, special someone, best friend. It's the things that you value the most outside these walls that make you so invaluable inside them.
I became a nurse because my oldest daughter was born with congenital heart disease, and I saw that one nurse made a big difference.
I had a patient very recently that said that our floor treated him like a human being, and I thought that was so strange, and I asked him, "What do you mean?" And he said, "You act like you really care about me, the person, not me, the illness."
And it's all about the patient, always.
Day in and day out.
It's good to come to work knowing that you're going to make someone's day just a little better.
Nursing excellence is being at your best for someone who may be at their worst.
We strive to give excellent care to patients. We see them in their best and at their worst moments.
But there's just as much honor in caring for someone at the end of their life as there is in helping them to get better and go home.
I had a patient who asked his family to come back and give me some roses so that he would know that I made a difference when he passed away.
Everything that we do is patient and family centered.
When I think of nurses at GMH, I think of the heartbeat of this hospital. I think of the foundation of everything we do.
Nursing excellence is making sure that what's said at the bedside is heard in the boardroom.
I want to make sure my voice is heard for my patients. I see it every day. I'm at the bedside. I know what my patients need. I know what they want. I have to make sure the rest of the organization knows what they want as well.
I absolutely think I have a voice. It's one of the biggest reasons I love working here.
We all have the opportunity to make a difference here. We are empowered to change things throughout GMH with nursing research, having the opportunity to sit on different committees. We are more than just nurses.
Nursing excellence is about balancing head knowledge with heart wisdom.
I think nursing is an art, and I think certification really shows that you're devoted to that and that you are committed to maintaining that art and that level of excellence.
We have various levels of experience and backgrounds and years and education. So I think that's really been helpful to get us all standardized in a way that, not to make us robots, but to make sure that we are following the same things repetitively because we know that they're the best thing for the patient.
When I first started nursing, we were doing things just because that's the way it had always been done, whether it was proven to be the optimal outcome or not. But now with evidence-based practice, we have the evidence to back us up to say that this will be the best for this patient in this situation.
As an educator team, we try to empower them with the knowledge to practice autonomously and to provide excellent care to our patients.
It's wonderful to have autonomy to where I can use my nursing judgment, I can use the nursing knowledge that I have to work under the physicians and still make some of my decisions based off of what's going on with the patient in order to provide patients the most excellent care that they can get.
We're providing great patient care at the highest level at this point, but we're always looking for opportunities to improve, and that's one reason I'm really excited to be here.
Nursing excellence means being united for your patients and their families.
We're team players, we love each other, we're a family.
And you can just sort of tell when you're around good people, and I felt a real strong sense of that. You can also tell and have a sense when you're around people who enjoy working together, and I certainly felt that as well. And I also felt I was around people who really wanted to function at the top of their profession.
Everyone has something to bring to the table. The nurse that has 2 months experience to the nurse that has 30 years experience.
And a lot of that revolves around teamwork. You cannot do it by yourself, so you have to rely on yourself and others as a team collectively coming together.
We're a strong team. We work together every day, and we're really there for the patient.
Nursing is a career, but nursing excellence is a calling.
That's all I ever remember wanting to be since I was maybe 5 years old.
I became a nurse after taking care of my parents, who were both struggled with chronic illness in their later years. And there was one time when I was bedside with my parent at 2 a.m. and a nurse came and asked me how my dad had been doing because she had taken care of him a few days prior. And after I updated her, she turned around and asked me how I was doing. And after that, I realized how much power a nurse has to impact every human body.
It's kind of in my blood. I grew up around a family full of nurses and people in the medical field, and I saw how fulfilling their job was to them. And 30, 35 years into it, they still came home every day and loved their job.
We strive to assure that our nursing professionals feel the same way.
We want to retain our current nurses in that nursing excellence, but we also want nurses worldwide to want to come to Greenville Health System because we have an empowered and quality-based environment in which to practice.
Greenville Memorial is the flagship facility in this area, and I knew that I wanted to be here, and I've stayed here because of the people. I've stayed here because of the staff, the doctors and the nurses that I get to work with every day, and the patients that we get to take care of.
I honestly can't see myself working anywhere else. I'm very honored to be employed here.
So I drive an hour every day to get here.
And it means that I work at the best hospital there is to work at.
That's why I love GMH, because we're a society of nurses who enjoy taking care of our patients.
We recognize that you are an invaluable part of the healthcare team of Greenville Memorial Hospital.
What keeps me here is our team.
I can't do what they do. I don't have the gifts that they have clinically, but I really like the idea that as an administrator, I'm able to help support those folks that do have those gifts.
And that's why we prescribe that you take care of yourself with the same level of excellence that you pour out for everyone else.